I'm here to talk about HB 2719. This is a bill that direct focus is relieving medical debt, particularly on working class people, particularly working class black and brown people. You know, when we think about what it means for someone to have a good life and to be able to live with some comfort, we have to think about them not having to be stuck or saddled with, thousands of dollars of debt, wondering if that debt is going to prevent them from being able to pay their rent, or if they're lucky enough, their mortgage, to be able to provide their kids with food, being able to fill up their gas tank or be able to get a bus card. And so when we think about this bill, it really says to hospitals that they need to screen a patient for eligibility for cost-saving, cost-reducing programs such as financial assistance and hospital-provided discounts. This bill goes even further that prior to taking collection action, so prior to going to a collecting agency against a patient, the hospital must screen the patient, exhaust all other cost-reducing avenues or measures before collective measures may be taken. This really, I think, is, again, it goes back to the fact that someone might wake up after a visit in the ER and they look in the mail and they see they have a bill. And that inevitably creates a shackle on their ability to live the life that they deserve or that they want. Before Obamacare got done, I remember I had a healthcare emergency and I was unemployed, and I struggled to be able to find proper healthcare. And the thing that concerned me the most was the cost. It ended up having me go to an FQHC, Howard Brown, but that was after I visited multiple hospitals. And I remember the first time I did that after visiting the emergency room and seeing that I had thousands of dollars in debt while also having no job, and knew that would put me in a very terrible position in order to pay rent or to buy food or be able to live my life. And nothing was more stressful and more frightening than seeing that giant bill and not knowing what I'm going to do with the little money I have in my pocket. And so to think that that is something that's still happening today for people is frightening and painful, and I would prefer that nobody has to go through that again.
Thanks for watching this video. Please like and subscribe to keep up to date with news from the caucus. For more information on what the senator is working on, you can follow them on social media using the links in the description below.